drug valsartan is being recalled in 22 countries. An external supplier introduced a chemical that might have a cancer link. The recall involves about 2,300 batches that were sent to Germany, Norway, Finland, Sweden, Hungary, the Netherlands, Austria, Ireland, Bulgaria, Italy, Spain, Portugal, Belgium, France, Poland, Croatia, Lithuania, Greece, Canada, Bosnia and Herzegovina, Bahrain and Malta. Novartis spokesman Eric Althoff said that products sold in the United States are not affected by this recall. The U.S. Food and Drug Administration says it is looking to see whether it has any information to share at this time and directed questions to the manufacturer, as it is the best source of information about their product. The impurity is N-nitrosodimethylamine, NDMA, an organic chemical that is in a family of potent carcinogens. The chemical has been used to make liquid rocket fuel, softeners and lubricants, among other products. It can also be unintentionally produced through certain chemical reactions and is a byproduct from some pesticide manufacturing, the making of rubber tires or fish processing. Animal studies have shown that NDMA can be toxic and cause tumors in the liver, kidney and respiratory tract. It can also be potentially harmful to humans in certain quantities. Exposure to high levels can cause liver damage and is a probable human carcinogen, according to the U.S. Department of Health and Human Services. The amounts of NDMA found in valsartan API are much lower than the cumulative endogenous production and usual external exposure of NDMA, Althoff wrote in an email. There is no certainty as to how much this contaminant may potentially increase cancer risk in humans. Thus, the amount of NDMA found in the valsartan API would not represent a significantly increased risk to the patient's taking of Sandoz valsartan and Sandoz valsartan HCT film-coated tablets. The European Medicines Agency and EU regulators are working to determine what impact this might have on patients and whether other drugs will be affected. The external supplier is used by other pharmaceutical companies as well, according to Novartis' statement, but the spokesman said it could not comment on those companies. The company says that no other Sandoz or Novartis products, even those that may contain valsartan, are affected by the recall. We continue to undertake an urgent review of all these products that may pose a low risk to public health, said Drive. Sam Atkinson, Director of the UK Medicines and Healthcare Products Regulatory Agency's Inspection, Enforcement, and Standards Division, Novartis said that although the amount of the NDMA in the drug isn't considered a significantly increased risk to the patients, patients should talk with their doctors to discuss treatment options as a precaution. Patients shouldn't stop taking their medicine, but the Medicines and Healthcare Products Regulatory Agency said it is vital that they get in touch with their doctors as soon as possible. Alternative medicines that are unaffected by the recall are available. The key with this is, patients should not stop taking their medication abruptly. That definitely can be harmful, said Drive. Mary Ann Bauman, a representative for the American Heart Association. You don't want to jump to any conclusions on your own about this medication, or any medication for that matter. Definitely talk with your doctor first. CNN's Mira Senthilingam and Deborah Goldschmidt contributed to this report.